All right. So it is just about 2 minutes past the hour, and I think we have a number of folks who have just joined us. So we're going to go ahead and get today's webinar started. So first of all, good morning and good afternoon to everybody, and welcome to Veterinarians Without Borders Women's Month webinar, Women of Veterinarians Without Borders, or VWB, Driving Change in One Health Around the World. My name is Kathy Turner, and I'm a board member with VWB North America, and I'm also a board member of Elanco Animal Health. I'm really excited and happy to be your moderator for today's discussion. We're going to be highlighting the leadership, the challenges, and the contributions of women in veterinary care, animal health, and One Health initiatives across the globe. So let's talk just a bit about Women's Month and today's discussion. Women's Month really is an opportunity for us to celebrate the contributions of women and advance discussions on gender equity and leadership in various fields, which is just so important. Today, we're spotlighting several women in VWB's programs. These women are driving change in veterinary care, animal health, and One Health initiatives across very diverse global contexts. Our three panelists will be sharing their insights on how women are transforming One Health in each of their regions. They'll highlight their experiences, the challenges they navigate, and the solutions they bring to working in their distinct communities. So, how is this webinar going to run today? First of all, each panelist will have approximately 10 minutes to present their insights and their experiences. If time permits, we'll transfer to a brief moderated discussion to explore some key themes that emerge. But finally, we will definitely open the floor to live Q&A session, where you'll have opportunity to ask questions directly to our speaker. And I want to make sure that we give you plenty of time for your Q&A. Now, to the audience participants, there is no need to wait for the Q&A to ask your question. If you have a question while one of the speakers is speaking, please just submit your question on the Zoom Q&A, which is a button at the bottom of your screen. Not the chat button, but the Zoom Q&A. You can do this at any time during the webinar, and then we'll refer to your question after our panelists speak. So we're going to get this started, and we are going to start with our first speaker, Dr. Michelle Tuma. And Dr. Tuma, you can feel free to pull up your presentation while I introduce you. Hey. Dr. Michelle Tuma is with the Northern Canadian, she's a Northern Canadian veterinary specialist with Veterinarians Without Borders. Michelle is a veterinarian from Yellowknife, Northwest Territories, Canada, and she's deeply committed to improving access to animal health services in remote Indigenous communities across Canada's north. Born and raised in Yellowknife, Michelle returned home after earning her veterinary degree from Western College of Veterinary Medicine. Since then, she's balanced private practice with her passion for community-based care, partnering with northern animal welfare organizations to deliver veterinary services in some of the country's most isolated regions. Since joining VWB in 2018, Michelle has helped launch the Northern Animal Health Initiative, or NAHI, which is a One Health program grounded in respectful, community-led partnerships. Her work focuses not only on improving animal health, but also on supporting Indigenous self-determination and strengthening community capacity. Today, Michelle will share her experiences working alongside Indigenous communities that are leading efforts to bridge veterinary care gaps, advocate for animal health, and build more resilient One Health systems. She's also going to reflect on the vital role that women are playing in transforming perceptions of veterinary care and deepening engagement in animal health programs. Very excited to hear your presentation, Michelle.
Thanks, Kathy. Can you hear me okay?
Yes, we can.
Awesome, perfect. Well, good morning, good afternoon, good evening, everybody, depending on where you are. I'm very honored to be speaking with everybody today. And as Kathy mentioned, I'll be chatting about our Northern Canada One Health programming for Veterinarians Without Borders. So I would like just to start off with a land acknowledgement. So today I'm speaking to you from Samba Cay, also known as Yellowknife in Northwest Territories, Canada. I'm located on Treaty 11, Chief Dry Geese Territory and the traditional land of the Yellowknives Dene First Nations from time immemorial. I acknowledge that my parents came as settler immigrants, and I remain grateful to have been born on these traditional lands, surrounded by the unique and beautiful landscapes with amazing people and abundant flora and fauna. During my work travels, I've been a visitor to many areas across Northwest Territories and Nunavut, including the territories of the Tlicho, Satu Dene Métis, Gwich'in, Inuvialuit, and Inuit. I deeply appreciate the continued opportunity to observe and learn about the culture and traditions that are the foundation of the Northern life. So, as you know, was introduced, I am living and working in Northern Canada, mainly across the territories of Northwest Territories and Nunavut, so the two most northern territories in the country of Canada. And so there are a lot of parallels to other remote areas across the globe, but also, some specific animal health related challenges that are present in the North as well. So some of the realities that we are facing when working in One Health or the veterinary industry is that there's really a limited or lack actually of veterinary infrastructure, both at the private and public and government scales. So to put that into perspective, in the Northwest Territories, there are only 2 private practice veterinarians in Yellowknife. Yellowknife is the capital of Northwest Territories, and we have about 50% of the population of Northwest Territories. And we only have 2 private veterinarians working here. We also have limited government animal health services. And in Nunavut, it's actually, a bit of a different challenges because there's actually no veterinary infrastructure. So there's 0 veterinarians who are employed within the territory of Nunavut. So for both of these territories, a lot of the access to animal care and to One Health programming is actually done by veterinarians or groups that are traveling from outside of the territory. Of course, because there is lack of access to some of this veterinary infrastructure, this poses a lot of challenges to the community level, and specifically community safety. So, there's a lot of dogs in community. They play very important traditional and more modern roles to the residents of the communities. However, with no access to veterinary care, it does lead to a lot of dog overpopulation safety concerns. With the dog overpopulation, there's of course risks as well with dog bites, with children and youth being the most at risk. Of course, dog bites are nothing that anybody ever wants to have to endure, but there's an added risk with dog bites in the north because of risk of transmission of rabies. So another animal health related challenge is, public and environmental health. Rabies is endemic in Northwest Territories and Nunavut, and it is transferred between wildlife and dogs very frequently. Luckily, we've had no cases of human rabies in the north, but it is a real risk that is present with the amount of rabies cases we've had through the wildlife and our dogs. There's also other parasite transmission as well. So other zoonotic parasites from fish, from dogs who are eating country foods. So as I said, fish, meat, things like that, that can then also be transferred to their people as well. So to support communities in addressing these challenges that they are facing with the lack of veterinary infrastructure, the Northern Animal Health Initiative was created. So It was piloted from 2019 to 2021, and there was 3 to 5 community partners across Northwest Territories and Nunavut. Since 2022, we've operationalized, and now we've grown to 11 community partners across the 2 territories. And we're also expanding to include other remote communities outside of the 2 territories. As well, we have a lot of communities still within Northwest Territories and Nunavut also asking for some assistance as well. So a brief overview of what a community partnership looks like in our NAHI program. One thing that we really like to emphasize is that all of our whole program is community driven and community led, meaning that we are not going into these remote Indigenous communities and telling anybody what to do. What we're doing is somebody from an individual from the community will reach out, and alongside the individual and stakeholders and leadership, we'll develop a plan that meets what they as a community and the leadership and community members identify as their priorities and their needs where they need support. So generally, we have a partnership agreement, and our first step is actually bringing a temporary veterinary clinic into the community to assess some community needs and also provide some immediate care as well, and build really on the relationships within the community with all of their residents. Generally, we'll have at least 1 temporary veterinary clinic within the community a year, but throughout the rest of the year, we're also supporting any sort of ongoing needs that the community themselves have identified. So whether that is, dog population management programs, bylaw revisions, any sort of things like that, we're happy to support their communities to really help to strengthen their capacity and empower the community to be able to be confident that their programs are going to be successful. So for our 2 main pillars of our program as well is, as I just kind of mentioned, the veterinary public health access. So temporary clinics that we travel to the community, have a clinic within the community. During that clinic, we're doing animal population management, so spays and neuters and education regarding spaying and neutering. Of course, rabies vaccinations and preventative care. Without any veterinarians for thousands and thousands of kilometers, it's really hard to access vaccines, and especially rabies vaccines, which can prevent a fatal disease. It's really important that we are vaccinating as many animals in each community for rabies to decrease that risk. Of course, offering emergency and critical care as we're there as well. Sometimes it's unlucky for a pet to receive an injury while we're in town, but it's also lucky that's occurring while we're in town. So we're happy to help when and where we're able to. And we also have a telehealth program as well that's launched across Northwest Territories and Nunavut. So it's really tailored to the unique landscape of the North, taking into account cultural and traditional practices, and the very remote landscape that these community members are facing. Our second pillar is strengthening capacity within the community, doing this through knowledge sharing and training. So providing education in animal health and welfare, training programs such as community lay vaccinators, pet first aid training, and community animal health worker programs. Of course, promoting pet ownership across the community and engaging with the youth as well. So we do a lot of youth engagement by going to schools. We have a lot of community engagement events where we chat about with elders and everybody else as well. And again, we're just really focused on empowering communities and making sure that it is the community is leading the program to their vision of what they would like animal health and welfare to be viewed as in their community. So we do a lot of collaboration. Everything is done with consent. All of our services are provided at no cost to community members to ensure that there's absolutely no barriers that are present for accessing care. And then, of course, as I said, the knowledge sharing and training as well. So one of the big training programs that we are currently working on implementing this year is the Community Animal Health Worker Training, which is a concept and program that is across the globe in many remote communities, and because of the unique and differences that are in Canada's north, there are a lot of parallels as well, but we've had to kind of, I guess, rethink how this program is going to work in our northern communities. So we will work this year towards training some animal health workers in things more than just vaccination, because we have some lay vaccinators already, to hopefully promote strengthening of their capacity and empower their community, and then result in improved access to animal health care. And one thing that's interesting is that mostly it is women who are interested in getting these trainings, and so the women in the communities still have full-time jobs, but they are aware of the lack of veterinary infrastructure and want to bring more to their communities. And so it's generally women, including young women, who are approaching our clinics and asking to have these trainings and further their education in the animal health and welfare realm. And so we do everything that we can to support them while we're in the community and ongoing as well. And so I do want to just take a few last moments to chat about some amazing women who are drivers of change in their communities. So this is Jocelyn, and Jocelyn was actually supposed to speak today, and she unfortunately had a family emergency, and so she couldn't make it, and I am stepping in for her. But I just wanted to highlight the amazing contributions that Jocelyn has done in her community of Pedzi Key in Northwest Territories. She is such a champion in her community. She does vaccinations for dogs when we're not present. She helps us organize everything for our temporary clinics in her community. If there's any concerns outside of the community times or the clinic times, she'll reach out and make sure that those animals are able to receive care. One thing too, she actually traveled with our VWB team to speak with us on a panel at the Humane Canada Conference in 2023. So speak about all that she's doing in her community and the amazing work that she's been able to accomplish. And so she's just one amazing Indigenous woman that we are able to work alongside and that we have the privilege of working with. We also have Shani in Tuktoyaktuk in Northwest Territories, and Shani is, in Tuktoyaktuk, another local Indigenous woman who is able to support our clinics in her community. So she is just amazing at organizing our clinics, getting people involved, and is just always keen to be able to help out with anything, including research, data collection, and just promoting animal health and welfare within her community. And then we have a wonderful young woman as well named Aaliyah. And Aaliyah is from Joe Haven, Nunavut. And We first met Aaliyah back in 2023 when she was still in high school and heard that we were having a vet clinic in her community and came out to want to help out in her community because she wants to become a veterinarian. And so we were just so happy to have such a powerful young woman come and help us in our clinic. She was able to also go to vet camps in PEI. She did a veterinary clinic exchange in Medicine Hat, Alberta as well. So she has this inner drive to really want to follow down a path in the veterinary medical field, but didn't have a conduit of doing that if our programs didn't happen to come to her community. So we're so happy to continue to support Aaliyah. She has now graduated high school, and we'll be seeing her actually in the beginning of May when we travel to Joe Haven again for another mid-year clinic. So thanks everybody for your attention and hearing my story of the programs that we're doing for VWB Northern Canada and the amazing Indigenous women that we're working with as well. And can't wait to hear what your questions are. Thank you.
Thank you, Michelle, very much. Really interesting and certainly, in my opinion, quite motivational. So I'm going to make a slight change in our agenda and move to our next speaker. Okay. I'm not going to make a change in our agenda. Our next speaker is Dr. Victoria Nordby, Dr. Victoria Afua Nordby. So Dr. Nordby is the president of the apex body of women in poultry value chain in Ghana, known as WIPVAX Apex. That's a mouthful, Victoria. Victoria is recognized as a leader in Ghana's poultry industry with extensive experience in gender equity, economic empowerment, and agricultural leadership. As the president of WIPVAC, she advocates for women's leadership in poultry, farming, and agribusiness, ensuring that women have access to the resources, training, and leadership pathways that are available in the livestock sector. She's also the founder and board chairperson of GLOUDEP, an organization focused on women's empowerment and sustainable development. Her contributions to gender equity in agriculture have earned her multiple honors, including an honorary doctorate in public administration and the Ghana Women's of Excellence Award. Today, Victoria will discuss how women in Ghana's poultry sector are driving economic empowerment, transforming food security, and strengthening sustainable agricultural practices. She'll also share with us how WIPVAC's collaboration with Veterinarians Without Borders VETS program is expanding training and leadership opportunities for women in livestock farming. Again, another interesting and very diverse presentation. Victoria, the floor is all yours. You're welcome to share your screen and get started.
Okay. Thank you very much for the opportunity. Good afternoon from Ghana, and maybe good morning to others all across the globe. I'm excited to be part of this webinar because we joined Veterinarians Without Borders quite recently, and I will say that we are one of the baby organizations. One of the baby organizations of Veterinarians Without Borders. But last babies can also do giant things. And so with support of Veterinarians Without Borders and all the other team members, we are moving on giantly. So we want to share our experience with you for the past almost 2 years, not fully, with VWB. So my screen, as you see, I just want to give introduction of what we want to do. Our governance structure will look at our partnership, the gender equity within the organization, the economic empowerment activities, impact, sources, challenges, solutions. It appears a bit long, but I speak fast, so I'm sure I'll be able to go through. Okay, so our organization is actually a strategic action for gender parity achievement. Because in 2014, the African Union Interbureau of Animal Resources actually had a project for the West African sub-region, ECOWAS, which they call the VetGov program. And as a response to this, they realized that throughout the project, women were not participating. Each time they call meeting, it was all men. Once a while, they would garnish the table with 1 or 2 women. So they wanted to find out whether women were actually operating within the poultry and livestock value chain. So they contracted a consultant who actually went to the ground and then came out with the fact that the women were actually there. So on 27th and 18th and 28th of April 2017, the AU, African Union Interbureau of Animal Resources, organized a workshop for us here in Ghana. And at the end of that workshop, the outcome was the formation of the Women in Poultry Value Chain. So indeed, we realized that since then, now because of our advocacy, because of our visibility, now each time they are inviting the men to the meeting, they know that there's a women group also. So they invite the men and they specifically invite the women group. So at least the group has actually helped us to get space within the agricultural value chain. So we were fortunate to come in contact with people and partners who are ready to help us. And in fact, because our slogan is "We Think Chicken," so when we say women in poultry value chain, we respond that we think chicken. So we think chicken has actually caught the attention of a lot of people, and they know that these are women thinking all about chicken. So anything about chicken, we are now invited to join. And so we want to look at our governance structure. We have a national body. Then we have an executive committee, which is made up of the regional leaders. Then we have the district executives. Then at the district level, we have members who are aggregating maize and soya for us for our feed, those who are dealing the feed inputs, those of us who are producing the chicken ourselves, those who are selling the eggs, some are selling live birds, some are processing the birds selling. The day which is people are bringing us chicks to sell, and then the SLS are distributing our eggs. So across the value chain, we have women working out. So we are operating in all the 16 regions of Ghana, but initially it was very difficult to reach out to our people. Thanks being to Veterinarians Without Borders, last year they were able to service with as many as 6 volunteers. 2 senior animal health workers started earlier, and their presence. So their presence was able to help us to reach out to the unreached. Our northern part of the country, the western border, is a very difficult area to reach. But the support of the Veterinarians Without Borders made it easier for us, because once their volunteers are around, they are able to support us to reach those people. And what are they doing? They are monitoring our farms. They are making sure that the best animal health practices are being carried out. They are making sure that biosecurity issues are in place. And as we do that, it gives us also a lot of visibility. In fact, the partnership has actually helped us to understand properly the concept of One Health. Now, our members and those we educate and globally are aware that we are talking about One Health, are talking about human beings, you are talking about animals, and you are talking about the environment. And so even those XLS who are not producing, who are not keeping the animals, they have also been educated to know that the environment in which they are selling must be clean. And so we introduced an aspect of food safety even into it. so that at any point in time, there are issues of One Health being communicated to our people all across the country. We talk about gender equity within the organization. Well, 99% we are women, but then our constitution allows that men who are interested in what we are doing, well identified, we can use them as our patrons. So we have here, you see that we have the disabled even in this meeting. So when it comes to the issue of disability and inclusiveness, we don't leave out the men. Once they form within the disability group, we include them in our activities. And one of those pictures exhibits our International Women's Day, which we celebrated with the support of the Veterinarians Without Borders volunteers who were around. And we were able to talk about the issues around the barriers that women are facing, the barriers that the men also face, because if you have the opportunity to talk to the men, they will tell you that they also face some barriers. But then we know that the issue, the long-term historical imbalances, is what calls for us to pay more attention to the women. So each time when they argue out that why always the women, why always the women, we are able to explain that, well, yes, the men are already there. So, but because of historical imbalances, we come in to do specific, some affirmative action, some tailor-made training for the women so that the gap can be closed. So for our gender issue, apart from the International Women's Day, we also integrate our activities with the school children, especially Menstrual Hygiene Day. Menstrual Hygiene Day, within One Health, we're linking it to human health and how we can also bring out these young people to be able to stay in school and come out as the future female leaders. And for the agricultural terrain, the most challenge is the access to finance. And getting access to finance is not very easy. You need to put so many things in place. You need to formalize your business. You need to follow the standards, the banking operations. We're talking about records keeping and the rest. So we make sure that we are empowering our women to be able to take advantage of the trainings that the Veterinarians Without Borders grant us, so that they can take advantage of the times and the seasons. But then in our own small way, we have started economic empowerment of the women in our local context. And we call it Entrepreneurship Savings and Loans Scheme. And in this Entrepreneurship Savings and Loans Scheme, the group is made up of about 20 to 30 people. And on bi-weekly or monthly basis or weekly, depending on what the group agrees on, we meet and we decide on some money to pay, which we call shares. So we float the shares into our own account. And then because once you become a group, welfare issues will by all means arise. So there's an aspect of the savings group, which we call social fund contribution. So the social fund contribution is also collected so that in the event that we need to follow some of our members who have some social issues like demise of a member, demise of a member's parents or close relatives. Sometimes the young ones are going for wedding. Sometimes the young ones, some are delivering. So we want to actually make room for those welfare packages. And then we have realized that it has actually helped us to put the group together. It has become a rallying point for the group because as we meet, and you know that your monies are there, by all means, you make time to attend the meetings. And once somebody is in trouble and they see the others rallying around, it's a motivation for the others also to join the group. The last time we have had to attend the funeral of the mother of one of our colleagues. And when we came back, our last meeting, which we held on Tuesday, we had as many as 7 people coming to register because they met us at the funeral, and the support that we gave actually drove them to come closer to belong to a group that cares for each other. So in doing so, these women are using this money also to take care of their children in school. To interest you to know that people come for the loan when schools are reopening, so that they want to take care of their children, make sure they are in school, they are taking care of their girl children. So we set up, we are actually working within the SDG 3s and 4s, and then plus the gender itself, because we are into education, we are into nutrition, and then the gender aspect. So it covers many parts of the SDGs as we work along. And there's a particular group in our northern part. If you're talking about the impact of the ESLG, they actually, sometimes people have money, but how to save it. So this has helped us to inculcate the habit of saving in our members, and they're able to save. Last year, for instance, we mobilized almost 1 million Ghana cedis from the groups, which they themselves were loaning. And in the northern part of the country, where the planting season is only one, our people use their money to buy foodstuffs when there's bumper season during harvesting time. Then they store it and sold it during the late season. They use some also in preparing their own feed. And they testified that some of them were able to buy land for themselves out of the accumulation of those monies. We acknowledge Madam Serena and her group from Wale Wale here for that outstanding work that they are doing. And we have a platform which we monitor the group. We do what we call e-monitoring, so that wherever you are, as you attend the meetings, you would record the number of people who are in the meeting, the amount you have realized, the next day for the meeting. Are there any other issues? Then you let us know. So we monitor the group for the next meeting. And so as we move on, you can see from this picture some of the VWB volunteers here. There's Dr. Kabwa there, plus the young volunteers who visited us last year. So in terms of food security, in collaboration with the VWB, we want to say that we are grateful. It has actually helped us. Last year, there was a serious enforcement of biosecurity on our farm through the volunteers. Dr. Joseph Dankwa was the key person who led that crusade to visit most of the farms to make sure that their farms have the correct food bags, the farms are clean, the biosecurity is perfect, so that we don't wait for disease outbreak before we are running for a cure. So we think that we stitch in time and we save money. So with the biosecurity, we now have less diseases occurring on our farm. And we also want to mention here that our activities to VWD has caught the attention of government. And so there was a well-bound program, which they call the West African Food System Resilience Program, in which women in poultry value chain was enrolled in. And that program is right now ongoing. And we have Dr. Akabwa visiting the women farms, the birds, advising them on husbandry practices, the health issues, the sanitation, the biosecurity, how to keep the farms so that there will be less disease and these women can make maximum profits out of it. That is still ongoing. Our birds are already ready for the Salah festivities and the Easter festivities ahead of us. So the capacity building in One Health, which we have mentioned, animal environment, it has cut across the entire country, because as the volunteers come around, we work out programs for them to visit our people and build their capacity. The good thing is that they are tailor-made training. that is done at the grassroots for people to understand. And I said earlier on that we have inculcated the food safety issues, because the SLS and those who are processing the chicken and selling, we must be sure that food is safe. And so there are questions also on food safety.
So excuse me, Dr. Nordby, I'm sorry, just so that we can make sure that Ruth has some time as well and we have time for Q&A, I'll ask you to kind of wrap up the successes and the challenges, because you have such a great number of them.
That's fine. So we're looking at our successes, so that through the partnership with VWB, the association has been able to reach out to over 2,000 members across the country. For example, the Savannah and the Northeast regions and Western North, which is difficult to reach. We have increased knowledge in One Health and food security. Farms have also been biosecured, like I mentioned, and trainings provided. And then we have integration of our International Women's Day, like I've mentioned, as well as our menstrual hygiene. The challenges we have is difficulty in reaching the women, but at least the Veterinarians Without Borders, when they are around, they bridge that gap for us. The next issue is access to finance for business expansion and sustainability. After we have gained the knowledge through all the trainings that we receive, what do we do with the knowledge? We need to actually put it into business and practice. So access to finance is one of the things we are talking about. The technical capacity is being built. We have a financial training even going on right now with one of the volunteers. And we believe that for sustainability, that we should also look at capacity building for leaders to be able to sustain the association. And for our own solutions, we started in a small way. This is the entrepreneurship chief I've talked about. We have farmer field schools and demonstrations where we learn from each other. And we also rotate these funds from region to region so that people can have access to what they have. In conclusion, I want to say that our partnership with VWB has been so great and enormous, and it has helped us to reach out to the unreached. And we are trusting that technically, as we receive the information, there will be that support for economic expansion also to expand their businesses. So special appreciation from members of the APES body of women in poultry value chain and all the indirect beneficiaries we extend to VWB and the sponsors Global Affairs Canada. Thank you very much for your attention.
Thank you so much, Victoria, for highlighting the role of women in agriculture and economic empowerment in Ghana. It's just really impressive to see the work your team has done. Our final speaker today is Ruth Zahiga Uwasi. She's our Cohers Project Coordinator at the University of Global Health Equity in Rwanda. Ruth is a global health professional specializing in monitoring and evaluation, research, and community health systems. She coordinates the Cohers Project, overseeing program activities, conducting research, and engaging with local authorities to strengthen One Health approaches at the community level. With a background in maternal and child health, public health research, and cross-sectoral collaboration, Ruth's work focuses on community-led education and policy to advance One Health approaches. Today, she'll highlight how the Cohers program is empowering women with the knowledge and leadership skills needed to drive veterinary and public health initiatives, ensuring that One Health solutions are both sustainable and inclusive. Ruth, welcome.
Thank you so much, Katie, for the introduction, and good afternoon and good morning, everyone.
Ruth, Victoria, if you could stop sharing your presentation. Can you get yours up there, Ruth?
No, she has to stop sharing before I can share mine.
Oops, Victoria, if you could stop sharing.
Yeah, I just stopping.
Thank you.
Okay. Thank you.
Okay, are you able to see my screen?
Yes, we can see it. It's not on full PowerPoint presentation, though, if there's a way you can. Yeah, or one more. Yep, got it.
Great. Yes, so as Kathy mentioned, I will be sharing about the Community One Health Empowerment Program in Rwanda. It is implemented through the University of Global Health Equity and the Center for One Health at the university. I just want to give a brief background and introduction about One Health in Rwanda. So in 2014 and 2041, the Ministry of Health established the National One Health Strategic Plan, which later on gave birth to the One Health Unit, which is housed in the Rwanda Biomedical Center in 2021. The One Health Unit was established to and has a mandate to identify priority diseases, to coordinate epidemic surveillance and response, and increase the number of One Health personnel in different communities, and especially rural communities. There's still challenges in trying to make sure that the environmental health, human health, and animal health sectors are collaborating together. And those include limited resources in terms of finance, in terms of human resources, and also the idea that working in silos works is also kind of stagnating the importance of working together as the three sectors. But this is being worked on and is being led by the One Health Unit in the Rwanda Biomedical Center. So why Coheres? Why did this program start? In the Rwanda Ministry of Health, there is an aim to reduce cysticercosis related morbidity in people by 25% by the year 2030. And that is how the Coheres Project was born. The Coheres Project has an aim to empower women and girls in rural areas, especially through One Health. And this is being done in areas with zoonotic disease prevalence. And the Coheres Project is specifically engaged in these programs in Nyamagabe district, which is in the southern province of Rwanda. To eliminate cysticercosis, there is a need for building infrastructure, latrines, improving wash. There's a need to vaccinate animals and also increase the knowledge of people on how to prevent these diseases. And that calls for a One Health approach. So from a research perspective, what the Coheres program is trying to do mainly is to identify and introduce gender transformative community activities. We're also doing trainings for One Health teams, which I will elaborate on a bit later. We are measuring the prevalence of the disease T. solium in people and pigs, and then testing human and animal wash solutions together in a randomized control study. Eventually, we're also hoping to calculate the cost effectiveness of all these activities to better engage all the policymakers in the ministries and the government for sustainable T. solium action. So as part of the Coheres education program, developed by the University of Guelph in Canada in collaboration with UGHE and WaterAid Rwanda, we have developed this structure to educate community health workers, community animal health workers, and WASH officers. So this is an aspect that brings together community members that really work in areas of animal health, of human health, and of environmental health. So some of the topics that they are trained on include gender, they include WASH, they include pig diseases and parasites and food safety. And this is done through modules that were developed that will be taught for 10 months. And these are the 10 modules that you can see on the screen. So as I mentioned, the community health workers, the community animal health workers, and the WASH officers that are being trained have now gotten a lot of knowledge and have now started to understand what One Health means. Out of the 255 community health workers and animal health workers and WASH officers that are being trained, almost half of them, 175 of them are women. They're really enthusiastic about this program. We have seen 100% retention since the program started, which was in October last year. We have seen people coming to these trainings. They're really eager to learn about zoonotic diseases, about One Health, and are even asking for more trainings that are taking place in the communities. We have also been able to give information to about 1,400 community members in Nyamagabe district about the prevention of teniasis in collaboration with community leaders, with the field teams that are on field, and we're really trying to make sure that people in these communities, especially rural communities that are at a high risk of getting these zoonotic diseases, understand how they can be detected, they can be prevented, and how they can be treated. Additionally, together with WaterAid, a partner on this program, we have also created and engaged over 20 hygiene clubs. And these include both women and men that are really making a change in their communities to make sure that they empower the people in their communities with a lot of WASH knowledge and One Health knowledge. In terms of gender inclusion for this project, there is always challenges and there's always opportunities to improve the participation of both women and men. These are some of the excerpts that we got when we were doing the pork value chain study in the same district, Nyamagabe district. And as you can see, there's a highlight that men usually attend trainings or education sessions that have to do with a lot of pig rearing and livestock in general. And that is one of the challenges that we face. Women are not invited to these trainings because men tend to think that they have other responsibilities or they will not be able to attend because of other factors. And as a norm, we also see that men are responsible for construction and making sure that materials are there to build pigsties and to also make sure that their animals are kept safe. But women are now in charge of taking care of the household and taking care of the livestock at home, which increases their risk of getting these zoonotic diseases that are transmitted through animals and the environment, but then they're not able to attend these trainings. There are opportunities that we have seen by training women, and some of them include the fact that community members feel very comfortable going to women and asking them questions around One Health, around zoonotic diseases, around prevention of these diseases. And it's one of the highlights that we have gotten from these trainings that they're able to give information, but even when they're not able to reach out specifically, people in the communities will learn about women that have the knowledge and they will be able to go to them. As a highlight of some of the women's contribution to One Health, the first picture shows a woman demonstrating to her community about safe hand sanitation with homegrown solutions in their communities. The second picture is of a woman veterinarian. And then the third picture is of a lady engaging a farmer, both women. And this shows the contribution of women in all aspects of One Health, both the environmental health, the animal health, and human health. What the Coheres program is trying to do, again, is to make sure that women have the understanding and the knowledge to be able to prevent these diseases for their households, but also communicate information to their communities. And finally, in order to link what is put in policy to what is practiced on ground, what we are doing as the Coheres project is to engage community leaders, but also engage high-level people in the ministries to make sure that there is collaboration. A good example of the importance of engaging community leaders that we have is that at the beginning, when we were starting the project, we were going into communities and doing a lot of community introduction. And we saw that this was taking about a week to make sure that the communities understand who this group of people that has come in is, to make sure that they understand what we're doing and what the benefit of this project is. When we started working with community health workers, community animal health workers, and WASH officers, what used to take us a week now takes us about 2 days. So we're able to get into the communities, quickly embrace and learn about what these communities know on One Health and zoonotic diseases, and then therefore be able to do a lot of field work in a very limited time or in a shorter period of time. So we also see that after the project, and even during the project, we're also still trying to share information with partners, with all the collaborators in One Health, in the government and in grassroots communities, share information with them and make sure that they also learn about what we're learning, and then work together to make sure that One Health is propelled in communities and in the country at large. Thank you very much, and I hope you enjoyed.
Thank you so much, Ruth. That was definitely another very interesting and important conversation about One Health in Ghana. We are going to go now to Q&A, and we are a little bit behind, so I'd like to extend the webinar to 11:05 Eastern Time. So if folks can hang in there for maybe 5 more minutes, I'd like to give each one of our participants at least an opportunity to answer one question each. So I'm gonna choose some questions, and obviously we won't get to all of them, but this webinar will be reposted on the Veterinarians Without Borders website, and we're going to speak to each of our panelists and see if we can get some answers to some of those questions that we aren't going to have time to cover today. I'm going to start, Ruth, with you. Since you are our last speaker, I'm going to ask you to answer our first question. And I do love both of the questions that have come in for you, but I guess I'll ask, because this was one that I was thinking about as well, is you mentioned men and women face very different barriers to engaging with One Health training. And it was interesting, men do this, women do that, and it's still a little bit of siloed. So what are some of the practical ways, just practical, simple ways that COHERS is actually working to ensure that both men and women are meaningfully included, and I assume, getting them both on the same page?
Thanks, Kathy. That's a really good question. So what we have tried to incorporate into these trainings that both men and women are specifically invited to is creating what we call leaders in the group. So when these trainings happen, they happen in different villages. So in each village, we tried to make sure that by volunteering, there was an equal representation of men and women in committee leadership of the trainings. So for each training, we have 2 women and 2 men who are kind of representatives of each training group. And these are people that the training members can come to with, what kind of barriers they're facing, who is not understanding one specific concept. And then from those 2 people, both 2 women and 2 men, these are kind of like our middlemen. And these are people that help us to understand, the specific barriers that are there. And we did this to make sure that everybody feels like they have a voice in the training sessions, and they don't have to directly go to a trainer or directly look for people on the higher up, but they can go to their the same training members that they're together with in the village. They have the same challenges in their village. If they're trying to educate people, they can go to these people, and then these people will also relay the information, and then we can make sure that we have a good understanding of both the challenges men are facing and the challenges women are facing. So that integration of women and men leaders in their own training groups is what has really helped us to understand these challenges, but also learn about the opportunities that are there for the trainings. Yeah.
Excellent. Thank you very much. Victoria, I'm going to come to you for the next question.
Okay.
what impact have women's savings and loan groups had on the everyday lives of your members, especially in how these women are able to care for their families or manage their farms?
Everyday life, for everyday life of people, like I mentioned earlier, that the loan scheme is always available, but when you observe, people will normally take the loan when it is time for schools to reopen, because then they want to pay their children's school fees, they want to put things in their bags for school. So it's a way also promoting education, it's cutting down the teenage pregnancy rate, because they're able to take good care, especially of their girls in school. But day in, day out, as we are producing ourselves, we have eggs and chicken at home, so the nutritional aspect is also covered. And once you have good nutrition, your health is also improved. Yes, yes.
Okay, great. Thank you. And Michelle, again, all of these we have some really good questions, so it's a little hard to pick. But I thought this one was very interesting. Michelle, for people who may not be familiar with Northern Canada, what's one thing you wish people understood about the connection between community well-being, animals, and the environment in these regions?
Well, great question. I think one thing that's interesting in working alongside these Indigenous communities is that just the concept of One Health, that is a bit more of a new concept in the scientific world, has been a way of living for Indigenous folks since time immemorial. So the interconnectedness of the environment, of the people, and of the animals is their way of living, and the practices, their traditional and cultural practices that they follow are all based on this type of One Health concept. And so, the integration of all of the three environments into one, and when we chat about it with folks that we're training within community or collaborating with, it's really cool to see that it's not a new concept for them. It's been a way of living for them for forever. The environment is important for them to thrive, and the animals around in the environment are also important for the people to thrive as well.
Excellent. Thank you. As I said, we went a little bit longer, so I want to be respectful of everybody's time. We will look to see, as I said, if we can get some of the answers, because there were some very insightful questions. I think today, I certainly learned a lot. We had such diverse conversations about Northwest Territory and working primarily with the canine population, Ghana, the poultry sector, and in Rwanda, One Health. And in all of these, there's such a common thread that it's powerful, smart women and motivated women that are driving these programs, and programs that are making a difference to the entire community. And so I just think those are wonderful examples, and I wish all of you continued success in your endeavors. I thank you for coming on and sharing your time and your stories with us. And I also would like to personally thank you for just the work that you are doing and the work your teams are doing. And thank you to our attendees for taking time out of your day to come and listen. Hopefully you took something away. And on that note, thank you, everyone, and have a wonderful rest of your day or a wonderful evening.